Hello, this is Dr. Hausinger, and this short PowerPoint presentation is based off of Chapter 7 in your Babor book, which is painfully short. You have some great Moodle module, say that 5 times fast, Moodle module resources this week, which will be more helpful to you. Okay. So these are some statistics on illicit drug use that you have seen, just as a review. We know what can and needs to be done to help reduce the burden of psychoactive substance use. Therefore, WHO is committed to assisting countries in the development organization, monitoring and evaluation of treatment and other services. And the WHO, of course, is the World Health Organization, and this is directly from their page. Okay. The harmful use of alcohol results in 3.3 million deaths each year. On average, every person in the world aged 15 or older drinks 6.2 liters of pure alcohol a year. Less than half the population, 38.3%, actually drinks alcohol. This means that those who do drink consume on average 17 liters of pure alcohol annually. And we know this to be true of drugs as well. A smaller portion of the population consumes most of the drugs. Some 31 million persons have drug use disorders. Almost 11 million people inject drugs, of which 1.3 million are living with HIV, 5.5 million with hepatitis C, and 1 million both with HIV and hepatitis C. Okay. So, what is harm reduction? It says it in the title. Harm reduction are practical, measurable techniques to help somebody who might not be ready or willing to give up their use completely use in a healthy way that's going to keep them alive. It's based off of the assumption that being alive is good. And originally, the first time that we saw the word harm reduction was in 1946 in an academic journal looking at adolescent behavior. And then it wasn't really used widely until the 1980s with the HIV epidemic. So some examples that you might be familiar with of harm reduction are needle exchanges, where users can go and get free clean needles, and they can also be educated on the proper ways to inject, and this includes maybe being given alcohol swabs, fresh cotton, and education on how to inject safely into their arms so as not to cause infections, irritations, abscesses, etc. Safe injection sites include places where people can go and be supervised by medical personnel in a clean environment, and with the understanding that if they do overdose, they will be taken out of the overdose. And safe injection sites generally also offer hygiene products and access to case management and treatment if a person wants that. Providing pipes instead of needles. In a survey, in a survey in Seattle in 2014 through the People's Harm Reduction Alliance. The People's Harm Reduction Alliance is an organization that provides safe injection kits and other harm reduction materials such as condoms. They did a study and they found that the majority of drug users on the street that they interviewed said that they would rather use pipes, but most exchanges don't have pipes. So they were able to, and this is monumental, they were able to get a grant from the federal government for $4,000 to buy a bunch of drug pipes, crack pipes, if you will, and distribute them to people so that they could smoke their drugs rather than injecting, because smoking is less harmful than injecting because of the route of administration and the body's natural defense mechanisms. Okay. DanceSafe is a Seattle-based agency that has chapters worldwide, and they provide drug testing kits specifically for club drugs such as MDMA. Their iodine testing kits. They also hand out water, because one of the biggest risks for ecstasy and MDMA is overheating and death due to overheating. Condoms. Moderation management is an example of harm reduction. It is a method so that people can consciously and mindfully track their drinks or their use and cut back. And they offer a variety of different skills. I recommend that you go to their website. MATs is medically assisted treatments, often medication assisted treatments. So you might see this both ways, medication versus medically. We usually refer to medication. That would be things like Suboxone, Vivitrol, etc. We'll talk about that in a bit. Nicotine patches would be an example of a harm reduction strategy, or nicotine gum, getting a designated driver, and first responders carrying Narcan. And now you can go to most pharmacies as a private citizen and buy Narcan over the counter from the pharmacist and carry it with you if you would like. We also see Narcan at libraries. Librarians are being equipped with Narcan because many individuals experiencing homelessness stay at libraries during the day. And so libraries have become a site for social services. Other harm reduction examples don't directly apply to drugs. For example, wearing sunscreen, you're reducing the harm. Wearing a bike helmet when you're riding a motorcycle or a bicycle. Wearing a seatbelt is an example of harm reduction. So we do all these things. This is a fancy term, but we do lots of things every day to reduce our risk. For example, turning the cold water on first and running your fingers under it before you turn the hot water on. I'm recording. Sorry, my partner just walked in with my tortoise, and she's here, so sorry. Okay, again, it's a zoo. Okay, daily harm reduction. Here's a nice little chart for you. Looking at the blood and alcohol levels, keeping it under a minimum. Okay, I think sunscreen, it's summer right now in Washington, and gotta wear your sunscreen. Okay, so it literally means reducing harm. Are there other things that you can think of? Think about if you have kids or things that your parents told you to do. We see harm reduction techniques in all aspects of our life. Okay. So here we have a scale, and this is, I encourage you to check out this website, harm reduction for IV use. So we have injection practices, okay, and it's a spectrum. So of course, not injecting, and maybe smoking drugs or snorting drugs would be safer than injecting. A little bit safer than that if a person is using sterile, unused equipment every time. Okay, so getting your own, not sharing, having your own kit that only you are using, and not reusing your equipment, but getting new equipment every time. Cleaning your own equipment every time if you can't get new equipment for each use. And then the most harmful would be sharing, lending, selling, or borrowing equipment. Okay. All right. This image depicts change from 2012 to 2015 in Canada in an area where harm reduction services were utilized. Okay. So in this particular instance, we had 895 naloxone kits dispensed since August 2012. 233 sites in BC, British Columbia, received harm reduction supplies. Over 8.2 million needles were distributed. Over 4 million condoms were distributed. 14,000 patients enrolled in methadone maintenance programs. And as a result of that, there were no overdose deaths at Insight. There was a 55% decrease in new reported cases of Hep C, 400 plus admissions from Insight onto Onsite, which is detox, and to treatment. 95 overdoses were reversed with naloxone. 42,000 referrals from distribution sites to other services, including mental health and social services, and a 78% decrease in new reported cases of HIV among people who inject drugs. So one of the arguments here is, are we enabling people to use? People are going to use anyways. So enabling means allowing the harmful behavior to change. Enabling generally has a negative connotation. Here, if we are helping people that are already at high risk and they're going to use no matter what, we're preventing death. We're preventing things that happen when all the things that people do to get drugs, using needles, selling their bodies, etc. Okay, so if we look at this through a public health lens, then we're seeing things a little bit differently. Not that we're enabling somebody to use, but we're looking at it from a health perspective and enabling healthier use and better choices. And it's not just, oh, here's my van, come inject. It's, there are services here. Do you need a sandwich, etc. Okay. Meeting clients where they're at. Okay. So Vancouver Insight is one of the best examples of this, and it's pretty close to us. And Dr. Gabor Mate, you may be familiar with from our 401 class. You read one of his books. It was instrumental with this. It is a safe injection site, and this is the average from 2017. You can see all their statistics on their website. So daily averages from 2017, 415 people injected, 537 people visited the needle exchange. So you see that not everybody did inject when they got there. 6 overdoses were responded to, and then 10 other healthcare treatments provided, which could be a variety of different things, screening, wound care, etc. And they haven't had any deaths. And they've been doing this for over 15 years. Total, they had 175,000 visits by over 7,000 individuals. So you see that people are coming back, and they come often. Right? They intervened with over 2,100 overdoses, over 3,700 clinical treatment interventions such as wound care and pregnancy tests were done. Most of the substances reported were heroin, 64%, followed by methamphetamine, 25%, and cocaine, 6%. 28% of participants were women, so more men, which goes with our other statistics, and 18% of the participants were Indigenous. In Canada, they're referred to as First Nations people. Okay. Right. Now, Insight has a sister service located there called Onsite, and they had 443 clients accessed the detox treatment facility with an average stay of 11 days. And then they do work with other centers elsewhere that they might have referred to. Okay, so I encourage you to go to those websites, play around a little bit. I think that the documentaries this week are going to illustrate this as well. From a policy perspective, this is really challenging because it's not illegal to have needles. We have needles and syringes for a variety of medical issues and treatments. You know, if you get the flu shot, you have a needle. If you're diabetic, you have needles. So we're providing paraphernalia, legal paraphernalia that's being used for illegal activities. So there's one issue with it. The other issue is the public perspective of, are we enabling? Okay. Well, the bottom line is abstinence-only perspectives do not work. If you tell teenagers don't have sex and don't give them condoms, guess what? We have more teen pregnancies. If you say, might not be a good idea for you to have sex, but if you do, this is how to keep yourself safe, we don't have as many teen pregnancies, and we don't have as many cases of preventable diseases. So it's really ignorant to think that I'm just going to tell you, don't do this, and you're not going to do it. Okay? So people are curious. It's in human nature to be curious. So it's important that from a policy perspective, you know, we're looking at the lines between health, crime, social work. We're looking at the line between illegal and legal, and it's not always a very clear line. Right? We do have to adjust things to keep people safe, again, off of the basic assumption that being alive is a good thing.